Amlyoidosis is a rare, systemic disease that occurs when a specific protein, called serum amyloid acid, misfolds and deposits as amyloid fibrils in various tissues and organs. This condition often develops secondary to chronic inflammatory disorders, making it a secondary form of amyloidosis. Causes. The primary cause of amyloidosis is prolonged, chronic inflammation. Under normal circumstances, SAA is an acute phase protein produced by the liver in response to inflammation, infection, or tissue injury. In healthy individuals, SAA levels return to normal once the inflammation resolves. However, in chronic conditions, SAA production remains elevated for extended periods. Some of the key conditions that can lead to amyloidosis include chronic inflammatory diseases rheumatoid arthritis, inflammatory bowel diseases like Crohn's disease, and ankylosing spondylitis are common culprits. Chronic infections tuberculosis, osteomyelitis, and other persistent infections can also cause prolonged SAA elevation. Familial Mediterranean fever FMF This genetic condition, particularly common in individuals of Mediterranean descent, can lead to recurrent episodes of inflammation, significantly raising the risk of amyloidosis. Over time, the persistently high levels of SAA lead to its misfolding and aggregation into amyloid fibrils. These fibrils are insoluble and accumulate in organs, impairing their function. Symptoms. The symptoms of amyloidosis are highly variable and depend on which organs are affected by amyloid deposition. The most commonly involved organs include the kidneys, liver, spleen, and heart, although the gastrointestinal tract, adrenal glands, and other organs can also be involved. Kidneys. The kidneys are most commonly affected. The first sign is often proteinuria, excess protein in the urine, which can progress to nephrotic syndrome, a condition characterized by severe protein loss, swelling, edema, and high cholesterol levels. If left untreated, this can lead to chronic kidney disease
Liver
and
and
eventually kidney
Amyloid
failure. Deposits can cause hepatomegaly, enlarged liver, and splenomegaly, enlarged spleen. Liver involvement may also lead to abnormal liver function tests and, in rare cases, liver failure. Heart. When the heart is involved, amyloid deposits can lead to restrictive cardiomyopathy, where the walls of the heart become stiff and less elastic. This condition can cause symptoms like shortness of breath, fatigue, and irregular heart rhythms, potentially leading to heart failure. Gastrointestinal tract. Gastrointestinal involvement can lead to symptoms such as malabsorption, diarrhea, weight loss, and gastrointestinal bleeding. Systemic symptoms. Because amyloidosis is a systemic disease, patients may also experience more generalized symptoms, such as unexplained weight loss, severe fatigue, and chronic pain, which are often associated with the underlying inflammatory condition. Diagnosis and treatment. Diagnosing amyloidosis involves a combination of clinical evaluation, laboratory tests, and biopsy. Elevated levels of SAA in the blood may indicate ongoing inflammation. A tissue biopsy, often of the kidney, rectum, or abdominal fat, stained with Congo red, can confirm the presence of amyloid deposits, which appear apple green under polarized light. Treatment primarily focuses on controlling the underlying inflammatory disease to reduce SAA production. Anti-inflammatory medications, such as disease-modifying antirheumatic drugs DMARDs or biologics, are commonly used. In cases of infections, appropriate antibiotics or antifungal treatments are necessary. In some cases, treatments targeting the amyloid deposits themselves, such as colchicine, particularly in FMF, can be beneficial. However, managing amyloidosis remains challenging, and the prognosis largely depends on the success of controlling the underlying disease and the extent of organ damage. In summary, amyloidosis is a serious and often underdiagnosed condition caused by chronic inflammation, leading to the deposition of misfolded SAA protein in various organs. Early diagnosis and aggressive management of the underlying condition are crucial for improving patient outcomes and preventing severe organ damage. The after effects of amyloidosis largely depend on the severity of the disease, the extent of organ involvement, and how effectively the underlying cause of chronic inflammation is managed. Here are some of the key after effects and long-term complications associated with amyloidosis. 1. Chronic kidney disease (CKD) and kidney failure. Persistent proteinuria. Even after treatment, many patients continue to experience proteinuria, which can indicate ongoing kidney damage. Progression to CKD. If amyloid deposition in the kidneys is significant, it may lead to chronic kidney disease, where the kidneys gradually lose their ability to function properly. End-stage renal disease (ESRD). In severe cases, the kidney damage can progress to end-stage renal disease, requiring dialysis or kidney transplant. 2. Cardiac complications. Restrictive cardiomyopathy. If the heart is involved, the stiffening of the heart muscle can lead to restrictive cardiomyopathy, where the heart is less able to fill with blood between beats, causing heart failure. Heart failure. The long-term burden on the heart can lead to congestive heart failure, where the heart cannot pump blood effectively, leading to fluid buildup in the lungs, legs, and abdomen. Arrhythmias. Abnormal heart rhythms may persist and increase the risk of sudden cardiac events. 3. Liver and spleen dysfunction. Hepatomegaly and liver dysfunction. Enlargement of the liver may persist, and in some cases, liver function may be compromised, leading to ongoing symptoms like fatigue, jaundice, and abnormal liver function tests. An enlarged spleen can continue to cause discomfort and may increase the risk of certain infections or blood disorders. 4. Gastrointestinal issues. Malabsorption and nutritional deficiencies. Ongoing gastrointestinal involvement can lead to malabsorption of nutrients, resulting in deficiencies and weight loss. Chronic diarrhea. Some patients may continue to experience chronic diarrhea, which can be debilitating and difficult to manage. 5. Fatigue and generalized weakness. Chronic fatigue. Many patients with amyloidosis report persistent fatigue, even after treatment, which can significantly impact their quality of life. Muscle weakness. Generalized weakness may also persist, especially if the disease has been ongoing for a long period. 6. Increased risk of infections. Immunocompromised state. Due to both the underlying chronic inflammation and the treatments, such as immunosuppressive therapy, patients may have a higher risk of infections, which can be more severe and recurrent. In summary, the after effects of amyloidosis can be profound and long-lasting, particularly if the disease is advanced at the time of diagnosis or if the underlying cause of inflammation is not well controlled. Continuous medical management, regular monitoring, and supportive care are crucial for improving outcomes and maintaining the best possible quality of life for patients.